So when we take the informed consent as a healthcare provider, all the time we have to explain to the patient what are the procedure, what are the patient diagnosis, what are the different option of the treatment, right? So after the explanation everything, we have to take their consent. So now in NCLEX board asks question, who will explain everything to the patient? The healthcare provider or doctor. Doctor has to explain the procedure, and also doctor supposed to take the signature by the patient. So what is the role of you? What are the role of us as a RN? Our role, we has to make sure my patient can understand the procedure, and also we has to make sure doctor taken the signature from the patient, or we make sure patient sign in the informed consent form, and also we will be there as a witness, I said. So informed consent, this must be obtained from a client or their healthcare proxy. If patients are not able to give their informed consent, if patient is psychiatric mental patient, if patient are not physically able, mentally not competent, right? That times their advanced directives or healthcare proxy should do this for any invasive procedure, any invasive procedure, and it is obtained by the healthcare provider. I mean, physician should do this, while the nurse role is to ensure the consent is signed, and also in the prior to the procedure we should take the consent, right? So basically, informed consent, I said there are healthcare provider, some responsibilities, and also when we work as a RN, we have some responsibilities as well. So basically, the provider responsibilities included communicate the purpose of procedure, should explain to the patient, complete the description of the procedure to the patient, right? And always make sure description of the procedure in the patient primary language. If patient do not understand EU language, we have to take care of the help the interpreter, medical interpreter, right, if needed. Also, we explain the risks of invasive procedure, and also what are the benefit. So after explain everything, after explain the risk factor, after explain the benefit, it is the patient right to make the decision, right? And we already finished, it's called autonomy. So patient has the right to make his or her own decision. If patient want and agree with you, then they give the sign. So description, other option also, when we explain the procedure, risks or outcome, also we have to explain what are the alternative option of the treatment, right? So it is the patient choice, what they like. but healthcare provider or doctor has to explain and take the signature or informed consent. Now question come, what is the RN, what is your roles, right? Or your responsibilities. So we make sure provider gave the patient all of the information and ensure the patient is competent to give informed consent. That is, patient is an adult, patient is adult to informed consent, or they are emaciated minor, right? If patient are under the 18 years old, but they are if I said if patient below or less than 18 years old, but they are married, we said emaciated minor. If patient is less than 18 years old, but they join in army, armed force, they are emaciated minor. So if patient mentally or physically able or competent, we as an RN, we make sure they are. Or if they are emaciated minor, that case, they can give their informed consent. What is emaciated minor? Example, a child is freed from parental custody and can become an adult in many ways. And when a minor marry or join is armed forced, he or she become emaciated from his or her parents. Another question, like under the 18 years old, a patient is diagnosed by sexual transmitted disease and he or she went to the healthcare provider with the parents. If patient say, don't tell it to my parents, and that times doctor has to follow him, and that case he or she is an emaciated minor, right? So I said as a RN, when we take the informed consent, we make sure they are competent or emaciated minor, and also have the patient sign. We have to make sure patient sign in the consent document. Also notify the provider, notify the healthcare provider if your patient has more question or does not understand any information we provide. We have to inform to the healthcare provider, right? So this is the basic talk about the informed consent.